Okay, we're continuing on with sodium right now. This is the second video, so part two of the nutrition one. So, and you'll see I made an edit to this slide for the sodium requirements being 1500 milligrams per day or less. So make sure you make that note from the notes you have. Make that correction. So we reviewed that healthy kidneys control how much of your sodium is in your body. But if your kidneys do not work well, sodium and fluid can build up. And your healthcare provider, for that patient with the kidney failure degree, we'll tell them that. If they even need to limit sodium even more than what I put on the recommendations here. And a lot of times they base that off of how their blood pressure is, how they're tolerating their fluid balance, which I mentioned earlier, that we can even see by just weighing people, get a great information by just weighing people. Many people are restricted to prevent sodium retention with, they get so much swelling in their body. So that's something specific. If you continue on in nursing, you'll see that people struggling with a degree of renal failure have blood pressure issues, swelling issues, problems with that. If they're on a high salt diet, it will make them thirsty, and often they're on fluid restriction, so that makes that even harder for them. It's okay. And oftentimes the disease that precipitated the renal failure, caused it, plays a role in determining the need for sodium restriction. So, also a little bit individualized. Again, potassium, first word up there is individualized. And remember, we talked about potassium back with our minerals. We know that it was the major mineral inside all of our cells that we have. Helps balance electrolytes, helps with our acid-base balance, helps with nerve impulses, muscle contractions, including the heart. And the kidneys help regulate potassium levels in our body. Because potassium, the blood levels that we can measure have a really narrow span for normal. So too high or too low can be very dangerous. Some people with kidney disease, most of them will be looking at a potassium restriction. And how much that is depends on how well the kidneys are working. This is where those registered dietitians really have a big job, because they're really helping assess lab work, being able to, offer some suggestions with the doctor about what their diet should look like right now. The nurses in there too, but registered dietitians play a big, big role with keeping people educated, and because there's a science behind it. When you look at all the electrolytes that the kidneys need to regulate, how well the kidneys functioning is going to impact how much of the electrolytes they should be eating. And when I say electrolyte, I mean something like potassium. The word electrolyte really means like a mineral, for example, in your body that has a charge, that has an electrical component. So potassium is considered an electrolyte in our body. And you really want to prevent low potassium because it can cause cardiac arrest. But high potassium as well can cause some bad problems with heart arrhythmias. Keeping in mind that a lot of salt substitutes are high in potassium. And potassium, since it's present in all plants and animal cells, because they have potassium in their body too, you'll find that the best sources are plants and animals. So I have a couple images I'm going to show you. I'll go back to the other slide after I show you this one. So some things that are high in potassium are listed on here. Some OJ, squash. I had a squash sitting on my desk the other day when I brought in all that food. Banana, milk, cantaloupe, spinach are some examples. And I also have, I wanted to show you a couple of these slides I put on here. In your textbook in page 445 and 446. Now these are a mixture, pardon me. a mixture of foods. Now, look at that first one. The beans are very high in protein and potassium. So you'd actually either avoid or restrict those in most cases. Again, there's room for individual circumstances, but for the most part, they're just very, very high. And that second listing, those fruits are very high in potassium and or phosphorus examples. These are vegetables that are very high in potassium and phosphorus. Just some examples of some most common ones. If you didn't know that we get a lot of our potassium from our diet right from potatoes. So it would just, when you do meal planning with these types of patients and talk it out, they really got to have, remember, a good amount of calories, balanced meals, good choices of fruits and vegetables, but not the ones that are exceptionally high in those electrolytes. Oh, and then I put a slide on do eat some good things like this, because these are great examples of fruits and vegetables that do not have an excessive amount of potassium or phosphorus in them. And just some examples. And I think, yeah, one more slide. I kind of added these from your notes if you want to look at. And feel free to even pause YouTube and take a look at them. Or there's more resources in your book too. Okay, I'm actually going to go back because I skipped through a slide that was on phosphorus and calcium. Just wanted to say a little something on phosphorus and calcium before I continue. Now, phosphorus is also tend to get very high blood levels in your body with kidney failure because your kidneys cannot excrete the phosphorus like it used to. So phosphorus tends to build up in your body. And, I'll just, in general, this is bad. Since the kidneys can't excrete, causes that high phosphorus level. And then I mentioned when we were on minerals just briefly that calcium and phosphorus have an inverse relationship. That means when one is up, the other one's going to be down. They work very well that way in balance to do their functions in their body. And oftentimes this means that if phosphorus levels are high, you're going to have low calcium levels in the body. I think I'm just going to leave it at that. There's a lot more science that goes a little bit with the phosphorus and calcium and vitamin D and calcitrol, but I think to share that with you might be a little overwhelming. If you have any questions about this, let me know in class. And just keep in mind, we're going to limit phosphorus. That's the important part. And we're going to want to make sure that our calcium levels are adequate in our body. And I'll just go ahead and tell you that because so many calcium foods also contain phosphorus, you're going to need to be careful with calcium foods. Most likely going to need to take a supplement. I have a slide on supplements here toward the end. And I'll keep going just because I want to kind of keep this within an hour, and I don't want to make you sit here much longer than an hour. So as far as fluids, most clients need to restrict their fluid, usually not in the first couple of stages. More like their salt, if this tends to be a blood pressure issue. Early stages, watch the salt. But as it continues to progress, because the kidneys can't no longer excrete excess fluid, I mean, really, your kidneys get to the point where they can't even make urine anymore. They need to restrict their fluid. Now, the range of fluid restrictions can vary quite a bit. I've seen it be as low as literally 500 mLs a day. That is like a half a liter. And most of us probably drink with foods and beverages at least 1,500 mLs. That'd be like a liter and a half, probably 2 liters actually, between our food and our beverages each day. But being on a fluid restriction with dealing with, just from my personal view from people in the hospital, is extremely high because the renal disease tends to come a chronic need. They're thirsty. They feel dry chronically, and all they want to do is drink. You know how I talked about non-compliance a little bit before? It's hard to place blame on a lot of these people and be judgmental when a doctor tells you you only can drink this much fluid for your safety. And they hear that, but it is so hard when they are so thirsty. So, but a fluid restriction is needed. With people on dialysis, they don't usually make urine at all. And say they go 2 days without having dialysis, any fluid they're consuming is going to stay on their body and add weight, increase their blood pressure until they have dialysis where they pull the excess fluid off. They can't urinate, so the dialysis would actually take the excess fluid out that we would normally make with just urine that they can't make anymore. So don't take for granted your ability to urinate. Excuse me. A little word on saturated fat. I don't think I need to beat this one to death because we covered it so good. What's our heart talk? Unfortunately, high lipid levels are common for clients with renal disease, keeping in mind the three biggest reasons causing renal disease: obesity, hypertension, and diabetes. And those people, we've talked about them, are at risk for high lipid. And when I say lipid levels, think about the cholesterol we talked about the other day and the bad cholesterol. So we're going to need to watch the saturated fat, no trans fat at all, and increase some good fats in there. I wrote just monounsaturated, but polyunsaturated, absolutely. I should have that in there too. Both types of good fats. So I'm not going to beat this one to death because we practically had a lot of talk about that the other day. And just a word on vitamins and minerals. Almost everybody that's on that has a degree of renal failure is on a vitamin mineral supplement. And a lot of times they are getting iron supplement because something neat that the kidneys do that you might not know is that they produce a hormone called erythropoietin, which actually stimulates the bone marrow to produce red blood cells. So if your kidneys aren't working correctly, you're actually going to have less red blood cell production in your body, and that can cause anemia. So we talked about iron being one of those trace minerals back a few weeks ago. That's going to help as a supplement fix this problem. And because we talked about so many food restrictions already, sometimes it is hard to get those vitamins and minerals from the limited amount of food choices that they have to take. So vitamin and mineral supplements are usually used. And yeah, I actually had on here, yeah, the National Kidney Foundation, yeah, makes guidelines that they need to have. Make sure 100% of all that. Something interesting, and because this is a result of restricted food intake of many foods, and I told you that, but also with that dialysis, they lose a lot of water-soluble vitamins. Excuse me, and they're given specially formulated vitamins. So pretty neat. And just my last slide to kind of wrap it up, just to review, pull it all together. I tried to keep this as basic as I could for as complex as it is. That chapter you even read through was really heavy. There's a lot to it. And one thing I did want to make sure I mention is that renal disease patients tend to succeed well on that DASH diet. And the DASH diet is something we talked about with our heart patients the other week. The dietary approaches to stop hypertension DASH diet. That works really good for these people too. So there's all my stages listed, and I made it focus on nutrient modification. So stage 1, carbohydrate control, if indicated, controlling blood glucose levels, especially if this has to do with the diabetic. Weight control is going to be important at that. Salt control probably too. But number 2, as it continues, now we're watching specifically our sodium, watching our lipid levels, thinking about how we can reduce that, maybe decreasing saturated fat, potassium, and you can see they kind of go over, like sodium. Let me get my mouse. Sodium is going to help control blood pressure, evaluate lipid levels, so we can reduce our cardiovascular risk. And then, know where we got to work from. Potassium, because we can have cardiac complications from elevated potassium. We're going to watch that. Now, when we get to stage 3, it's all of these carbohydrates, sodium, lipid, potassium, plus the next one I have listed. So, phosphorus. Begin to monitor and treat as indicated to maximize bone health. Because if we have high phosphorus levels in our body, it causes our calcium levels to be low, and then we can get brittle bones and bad things like that. And stage 4, let's add protein and put I don't know why I have potassium on here again, but protein. Really start watching our protein. Promote adequate but not excessive, because remember that causes increased urea, which is a toxin. And when we get to stage 5, it's highly individualized. Depends on what type of dialysis, how their kidney function is at that point, and we'll look at lots of things in consideration. So that was a lot of stuff to take in. Please let me know if you have any questions, and thanks for reviewing this. My stop button. Feel free to email me if you have any questions. Thank you. I'm done talking.